District leaders in Georgia face a hard deadline. By July 2026, the HB 268 mandate requires every school to implement comprehensive mental health support. The law carries concrete requirements: active behavioral threat assessments, suicide prevention protocols for grades 6 through 12, and documented violence prevention programs. While requirements are clear, funding is not. Stagnant budgets prevent most districts from simply hiring a new fleet of full-time in-house clinical staff. This gap in care coincides with a measurable, steady rise in Tier 3 behavioral crisis events across the student body. When you plot those rising crises against the available internal funding to handle them, the lack of resources becomes a structural bottleneck. Schools are effectively trapped between a rigid legal requirement to provide care and an absolute inability to afford traditional clinical hiring. MentalSpace School offers a different approach. It's a teletherapy intervention model designed specifically for K-12 integration. They provide a dedicated clinical team to each school, allowing same-day access for new student referrals. For the district, this represents an operational shift, from managing internal clinical hires to facilitating an external partnership. This model forces a choice: evaluate if the administrative effort of integrating a third-party platform is worth the promised clinical outputs. To make that evaluation, leaders must look past the claim of minimal budget impact and understand the specific operational trade-offs involved in digital therapy. Financially, MentalSpace operates on a model that bypasses the school's operating budget entirely. This flowchart shows the mechanism. Services are billed directly to Medicaid, which covers care at zero out-of-pocket dollars for the family. The same mechanism applies to major commercial networks. By billing insurance providers directly, the district avoids using its own limited funds for clinical care. This results in no setup fees and no long-term lock-in contracts, removing the typical financial barriers to launching a clinic. However, the school takes on a new administrative role. Staff must act as the primary facilitators for parental consent and insurance verification logistics. There is also a family-level trade-off. Households with high-deductible commercial plans may face unexpected out-of-pocket costs that the school cannot control. Ultimately, this financial model exchanges an upfront district budget hit for ongoing school-facilitated insurance billing logistics. There is also the matter of the format. You are weighing the traditional physical counseling model against a dedicated teletherapy team. The primary benefit here is speed. Digital access eliminates waitlists, allowing for same-day intervention when a student is in distress. That speed translates to data. Partner schools report an 89% improvement in attendance as therapy targets the root causes of school avoidance and trauma. There is a secondary academic impact as well. Grades improve by 76% as therapy restores the cognitive bandwidth students need to actually learn. After at least 8 sessions, 92% of students report a significant reduction in anxiety symptoms. These results depend entirely on a screen-based format. This represents a significant shift in how care is delivered within the building. Using screens means losing the hallway relationships and passive observation that an in-person clinician naturally provides. Schools must decide if the holistic presence of an in-house counselor is more valuable than the sheer speed of digital access. To make the partnership work, existing school counselors must participate in weekly coordination meetings with the external MentalSpace team. This integration protects your internal staff. By outsourcing the heavy clinical and trauma load, your counselors can focus on the relational and advocacy work only they can do. After 6 months of partnership, counselor burnout scores drop significantly as the clinical load is lightened. The program also addresses secondary trauma for teachers through dedicated wellness sessions and crisis debrief protocols. This structure fulfills the threat assessment and suicide prevention training required by HB 268. The operational friction comes from data management. The partnership requires constant, rigid FERPA and strict HIPAA privacy compliance. Administrators must maintain precise data silos while ensuring just enough critical information is securely shared cross-team to keep students safe. Relieving staff burnout requires the trade of taking on the new burden of managing data privacy protocols between 2 separate organizations. The core ROI is clear. You are exchanging physical presence for immediate access and shifting budget hits to insurance logistics. We can map the value of this service using a simple matrix. We plot counselor burnout against the district's available clinical budget. The MentalSpace model is designed specifically for this top left quadrant. These are the districts with high staff burnout and very low available budget. In contrast, the bottom right quadrant, low burnout and high budget, favors the traditional in-house hiring model. The strategic value of this service is directly proportional to a district's lack of existing clinical infrastructure. Affluent districts wanting total, in-person control regardless of the cost should likely avoid this model. The ideal candidate is a public district facing the 2026 mandate with zero budget to spare. For those schools, this partnership provides a critical pressure release valve for students currently lost to long community waitlists. For interested districts, the next step is the 20-minute MentalSpace Insight Survey. Custom proposals arrive within 5 business days, and the platform allows for immediate clinical access upon launch. This provides a direct path to care, opening doors for students the same day they reach out for help. Ultimately, the strategic choice rests on whether the benefit of rescuing chronically absent students today outweighs the administrative effort required to host the platform.